Hi, and welcome to the first presentation in a 10-part series, Medication Class, the Pivot Perspective. Here's the necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any diseases. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. Hi, my name is Dr. Amy Nabrick, and I am the founder and CEO of Pivot Integrative Consulting. I am a doctor of pharmacy with over 20 years of experience in community pharmacy practice. As an integrative pharmacy specialist, I empower my clients to discover root causes for chronic conditions and improve gut health using functional medicine, integrative pharmacy, and nutritional recommendations. I provide more meaningful interactions, interventions, and connections while healing the gut using food as medicine. The first topic in this series is diabetes and metformin. The objectives for this presentation are to provide information on blood sugar, how does it work, define macronutrients, contrast the two main types of diabetes, provide information on some complications of high blood sugar levels, discuss metformin and what it does, provide information on the micronutrients and vitamins that metformin can deplete, and why that's important, provide information on nutrition for diabetes, and then how can Pivot help you with your health and wellness goals? Let's start with the basics about blood sugar. How does it work? So the foods that we eat contain a combination of macronutrients. Macronutrients are proteins, fats, or carbohydrates. Protein sources may be from non-animal sources like pea proteins, beans, or nuts. They may also be from animal sources like chicken, eggs, beef, pork, etc. Fats include oils like olive oil, avocado oil, or coconut oil, as well as butter or ghee, which is just clarified butter, and that means it was melted and had some of the milk solids removed. There are also other saturated fats. Often animal sources of protein, as well as nuts, also contain fats. Then we have our carbohydrates, which include our sweet treats, grains, fruits, and vegetables. So let's focus on the carbohydrates for a moment. When you eat carbohydrates, as well as some proteins, it is broken down into sugars like glucose in our body. The glucose leaves the intestines and travels through the liver. The liver can also produce its own glucose for the body's energy needs. The glucose then enters into the bloodstream. That is what's known as our blood sugar. We then have an organ called the pancreas that produces insulin. Insulin is like a key that signals our body's cells to take in the glucose to be used as energy. So what happens in diabetes? According to the CDC, about 1 in 10 Americans have diabetes, and about 1 in 5 of those people with diabetes don't even know it. More than 1 in 3 American adults have prediabetes, with more than 8 in 10 adults with prediabetes not even knowing it. In 2019, about 1.4 million new cases of diabetes were diagnosed. For adults diagnosed with diabetes, 69% also had high blood pressure, high cholesterol, 44% had high cholesterol, 39% had chronic kidney disease, and 12% reported having vision impairment or blindness. It is estimated that the medical and lost wages cost for diabetes in the United States is $327 billion. There are different types of diabetes, but I'm only going to mention the main two types, which are type 1 and type 2. Type 1 diabetes is an autoimmune condition where the body attacks the insulin-producing beta cells in the pancreas. Type 1 is usually diagnosed in children or young adults, but it can occur at any age. The beta cells in the pancreas stop or significantly reduce the amount of insulin being produced. Remember that insulin is the key to let blood sugar into the cells. When the pancreas makes less or no insulin, this leads to very high blood sugar levels and an emergency situation, which is usually how it is diagnosed. Type 2 diabetes, on the other hand, is due to insulin resistance. The cells stop responding to the insulin signal to take up more glucose. Blood sugar levels remain high because the cells are not responding to the insulin. So the body signals the pancreas to keep producing insulin. Eventually, the beta cells will burn out if the blood sugar levels are not decreased. This form of diabetes is usually diagnosed later in life. The person diagnosed with type 2 diabetes is usually overweight, and a family history of diabetes can also increase the risk for developing type 2 diabetes. So when the system is overloaded with processed foods, high carbohydrate foods, and sugar, the cells get so saturated with glucose that they can't take in anymore, and they start to ignore the signals by the insulin to take more in. Insulin keeps knocking, but the cells no longer listen. That is called insulin resistance. The higher the blood sugar is, the more likely that damage will occur. Diabetes carries major risk factors for stroke, heart attack, and peripheral arterial disease, which is the narrowing of blood vessels, particularly in the legs and feet. Blood sugar levels that stay high for a long period of time can cause damage to nerves called neuropathy, eyes called retinopathy, or kidneys called nephropathy. High blood sugar levels also make it harder to heal from wounds. Now, if you think these complications aren't a big deal, picture this scenario. A person with diabetes has neuropathy in her foot. She steps on something and it causes a small cut. She doesn't feel the cut due to the neuropathy. The cut becomes infected, but she still doesn't feel it. The infection gets worse and worse and develops into a foot ulcer. She still is not aware until the infection spreads to the bone and gangrene sets in. By the time she gets help, it is too late, and the foot must be surgically removed. Amputations due to complications from diabetes happen more frequently than you might think. As gruesome as this is, sometimes sobering statistics can make a difference with the choices that people make, which is why I'm sharing this information with you. In the United States, about 73,000 amputations of the lower limb not related to trauma are performed every year on people with diabetes. 10% of people with diabetes currently have a foot ulcer. The lifetime risk of developing a foot ulcer for someone with diabetes is 25%, so 1 out of every 4 patients with diabetes could develop a foot ulcer at some time in their lifetime. Between 10 to 15% of diabetic foot ulcers do not heal. And of the diabetic foot ulcers that do not heal, 25% of those will require amputation. Up to 50% of diabetic foot ulcer cases can be prevented with appropriate education focused on teaching people with diabetes how to care for their feet. So I have a question for you. When was the last time your doctor actually taught you how to properly care for your feet? Now that I have given the background of diabetes and some of the complications that can happen with high blood sugar levels, let's talk about one of the treatments that is used for type 2 diabetes in allopathic medicine, metformin. Metformin is in a medication class all by itself, called biguanides. Metformin decreases sugar production in the liver, decreases intestinal sugar absorption, and increases cellular insulin sensitivity. Caution is advised for people with congestive heart failure or decreased kidney function due to kidney disease. Side effects of metformin include diarrhea, which is related to the sugar that doesn't get absorbed in the gut, nausea and vomiting, metallic taste, headache, rash, physical weakness, lack of energy, and a rare side effect called lactic acidosis, and that is usually related to the kidney dysfunction mentioned earlier. Now let's talk about some of the micronutrients that metformin depletes. Metformin can deplete vitamin B12, also known as cobalamin, folic acid, also known as folate, and coenzyme Q10. Vitamin B12 is important for red blood cell production, the formation of DNA in our cells, nerve function, metabolism, and energy production. A vitamin B12 deficiency may lead to memory problems, nerve damage, an increased risk of Alzheimer's disease or dementia, and mood changes. People with long-term severe B12 deficiency may develop an anemia and show up as weakness and fatigue. It is also linked with an increased risk of cancer and heart disease. Folic acid is a key to healthy cell growth and function, making of DNA and RNA, and is necessary for the formation of red blood cells. Folic acid is also part of the methylation pathway, which assists the body with detoxification. Folic acid reduces the risk for birth defects and preterm birth. A folic acid deficiency can show up as an anemia with weakness and fatigue. This anemia is usually in conjunction with vitamin B12. In fact, folic acid supplementation can often disguise a vitamin B12 anemia. Folic acid deficiency also shows up as difficulty concentrating, irritability, and headaches. A person with folic acid deficiency may also have mouth or tongue sores and changes in skin, hair, or fingernail pigmentation. As mentioned previously, folic acid is part of the methylation pathway, which is part of the body's detoxification process. Changes to the MTHFR gene can inhibit the conversion of folic acid to its active form. This would elevate homocysteine levels in the body and increase systemic inflammation. Therefore, a folic acid deficiency, because of that systemic inflammation, can increase the risk of Alzheimer's disease and dementia, cardiovascular disease and stroke, depression, as well as neural tube birth defects. Coenzyme Q10 acts as an antioxidant and is critical for muscle health. Coenzyme Q10 is needed to create energy in all of our body cells. It can lower blood pressure, reduce platelet stickiness, which discourages clots and strokes. And it also provides immune and cognitive support. A CoQ10 deficiency can lead to physical and mental fatigue, difficulty concentrating, memory lapses, mild to moderate depression, and irritability. Chronic pain is also common with a CoQ10 deficiency, with frequent headaches or migraines, muscle and joint pain, and an increased risk for developing fibromyalgia. Deficiency leads to a weakened immune system, which makes people more susceptible to cold and flu viruses, as well as chronic dental infections. The increased inflammation that can come from a CoQ10 deficiency can lead to high blood pressure, high cholesterol, and heart failure. Did you notice that there was an overlap with complications of diabetes, as well as the side effects from nutrient deficiencies caused by metformin? So often, providers might confuse the side effects from those nutrient deficiencies caused by the drug metformin with actual progression of diabetes. So rather than treating that underlying issue, they would just think that the diabetes was progressing. So such things as nerve damage, development of heart disease, increased systemic inflammation, which leads to high blood pressure, peripheral artery disease, and high cholesterol, and an increased risk for heart attacks and strokes. So it's really important to know about these types of deficiencies if you take or prescribe metformin. Now let's talk a little bit about diabetes and nutrition. So one thing that you should do if you are diagnosed with diabetes or even prediabetes is unleash the power of vegetables. So one half to one third of your plate should be vegetables. Eating the rainbow, so eating a variety of vegetables, getting some more variety in your diet of all the different colors that are available. Making sure you're getting quality carbohydrates and not empty calories just from sweets and processed foods. Also, looking into the Mediterranean diet or a modified version of the Mediterranean diet can help improve your blood sugar levels. Reduce consumption of flour, sugar, and processed foods. So the gluten that's in flour can damage the intestinal barrier, which leads to leaky gut. Leaky gut increases systemic inflammation. It's also a good idea to look into intermittent fasting. And I would highly encourage you to be under the supervision of a provider prior to making any of these kinds of changes in your diet. We would also recommend a probiotic for overall gut health, as well as incorporating more functional foods for diabetes. What are those functional foods, you ask? I'm so glad you did ask. Those include blueberries. So the anthocyanins in blueberries can exert an anti-inflammatory effect in some fat cells and increase the body's uptake and utilization of glucose. Cacao, or dark chocolate, the darker the better, promotes vasodilation, enhancing the delivery of glucose to muscle cells and alleviating hyperglycemia. Coffee and green tea may reduce the risk of type 2 diabetes by combating oxidative stress, so they work as an antioxidant, as well as promoting overall gut health. Fermented foods, so yogurt, kefir, and kimchi, have been shown to improve glucose metabolism, reducing risk for type 2 diabetes and enhancing glycemic control. Some other foods include nuts and seeds, so just a small handful each day of nuts can lower triglycerides, LDL cholesterol, and A1C in adult diabetics. Chia seeds reduce blood pressure and post-meal high blood sugar levels. And select nuts that are raw or lightly roasted and avoid those that are coated in industrial oils like canola oil. Olive oil has been shown to have reductions in fasting blood glucose and improves post-meal blood sugar response. We also have our resistant starches, so green bananas, plantains, lentils, white beans, and oats. That is the type of starch that feeds our gut microbiome and is not absorbed into our body. And that actually can help us control our blood sugar levels as well. And then there are some spices like cinnamon, garlic, and curcumin. Cinnamon has had a lot of studies done on it to help with diabetes control, and curcumin is great at reducing inflammation in the body. So how can Pivot Integrative Consulting support your diabetes goals? So let me tell you a little bit about what we offer. So here at Pivot, we offer concierge consulting services. You can take a deep dive into your health with a comprehensive, personalized consultation with an integrative pharmacy specialist. That is to determine some of the root causes of your chronic conditions. Our recommended programs are 6 months of one-on-one sessions, lab testing and reviews, and nutrition and supplement recommendations, if necessary. Multiple points of contact each month provide meaningful interactions and help you achieve your personalized goals. We also will do comprehensive lab reviews, including basic labs like thyroid function, CBC, A1C, metabolic panel. If your primary care provider has already performed these labs recently, there's no need to repeat them. With your permission, we'll just review them with a functional medicine approach. Additional labs may be ordered just to help us get an idea about the root causes of your disease and to check for deficiencies. So these labs look at gut health, food sensitivities, hormone testing, nutritional deficiencies, and genetic testing. You know, everyone is unique and responds differently, so we need to provide a more personalized approach. Perhaps you just need someone to review the medications that you already take. We are here for that too. A comprehensive personal review of all of your medications can determine if there are any duplications, interactions, or potential deficiencies. Again, using that functional medicine and integrative pharmacy approach, we will look at your medications and see if maybe your medications are causing a deficiency in folic acid or CoQ10 and suggest supplementation. MTM empowers you, the client, to be an active participant in your own health and wellness. Depending on what is discovered in the deep dives, personal history, MTM, or lab work, a good quality supplement may be necessary to start you on your path to wellness. We may have to provide a probiotic to help your gut to heal. Um, you make you can make sure that you're getting the right kinds of supplements for your needs. For instance, if you take metformin, do you have an appropriate B12, folic acid, or CoQ10 supplement? What if your methylation pathway is inhibited by a change in your MTHFR gene? What if your folic acid supplement that you're taking isn't sufficient for your body's needs because of that gene change? Does your supplement provide you with the right kind of folic acid? Are your supplements adequate for your specific needs? So there's really only one question left. Are you ready to pivot to functional health and wellness? Feel free to contact me today for a free 10-minute connection call. You can contact me at info@dramynaprick.com. That's info at dramynaprek.com. Here is a list of references for this presentation. And thank you for being here. Feel free to contact me at any time. Again, that email address is info@dramynaprick.com for a free 10-minute connection call, or if you have any questions about this presentation. Also, check out my website, dramynaprick.com, for more presentations and articles about health and wellness. I hope you have a wonderful day on your journey to health and wellness. Take care.